ब्लड पैथोलॉजी आज कंटिन्यू करेंगे और आज के वीडियो का टॉपिक है सिकल सेल एनीमिया. Now that's a very well known disorder, or it's been quite a while. I mean, काफी decades हुए हैं कि we know about this disease और इसकी exact pathogenesis हमें पता है. So we know what is the problem. The problem is basically with the structure of the hemoglobin. So it is labeled as one of the hemoglobinopathies. Hemoglobinopathies का मतलब ये है कि वो pathologies which affect the structure and functioning of hemoglobin. So hemoglobinopathies are a group of hereditary disorders caused by mutations that lead to structural abnormality in the hemoglobin. So that's basically the definition of hemoglobinopathy, and sickle cell anemia is one of the hemoglobinopathies, and there are so many others obviously. Sickle cell anemia is actually the prototype hemoglobinopathy. It is caused by mutation. अब सुने mutation कहाँ है? It is present in the beta globin gene. और आपको इसके लिए basic structure पता होना चाहिए hemoglobin का, कि hemoglobin में there is a heme component which is iron, and then there is a globin component which is protein. Then there are different protein chains, one of which is the beta globin chain. और beta globin chain में अगर mutation है, then that is the cause of sickle cell anemia. और ऐसे hemoglobin को हम नाम देते हैं hemoglobin S. S is for sickle cell. So if somebody has mutation in the beta globin, this is then known as the hemoglobin which is present in sickle cell disease, so HbS. There are different types of HbEs. So there is hemoglobin A, which is hemoglobin adult. Then there is hemoglobin F, which is fetal hemoglobin. So S hemoglobin is the one which is present in sickle cell patients. Numerous other hemoglobinopathies have also been identified, but these are infrequent as compared to the sickle cell anemia. Sickle cell anemia is the most common familial hemolytic anemia. सुने जी, अगर आप hereditary diseases की बात करें as far as the hemolytic anemias are concerned, we are dealing with the topic of hemolytic anemia, जिसमें red blood cell rupture होगा, फटेगा. So ऐसे anemias में sickle cell is the most common familial cause of hemolytic anemia. In parts of Africa where malaria is endemic, the gene frequency approaches 30% as a result of protective effect against Plasmodium falciparum. So that's an important association to remember कि अफ्रीका में ऑब्वियसली मलेरिया बहुत कॉमन है, एंडेमिक है, तो वहाँ द जीन फ्रिक्वेंसी अप्रोचेज अबाउट 30% एज अ रिजल्ट ऑफ प्रोटेक्टिव. सो दिस इज रिलेटेड टू द प्लाज्मोडियम फैल्सिपेरम मलेरिया कि द जीन ऑफ द बीटा ग्लोब. अभी हम पढ़ेंगे इसके बारे में कि व्हाट एग्जैक्टली वी आर टॉकिंग अबाउट, किस जीन की हम बात कर रहे हैं. बट देयर आर जियोग्राफिकल डिफरेंसेस इन जेनेटिक एक्सप्रेशन बिकॉज ऑफ सेलेक्टिव प्रेशर्स ऑफ सम अदर थिंग्स. जैसे यहाँ पे मलेरिया इज द सेलेक्टिव प्रेशर एंड देन द जीन फ्रिक्वेंसी चेंजेस. In the US, approximately 8% are blacks are heterozygous. यानी कि this concept of heterozygosity. Heterozygosity का मतलब ये है कि for every gene we have we have one chromosome coming from the father and one chromosome coming from the mother. Such chromosomes we have 23 pairs. तो ये जो 23 pair है उसमें one of the pair is from the father and one of the pair is from the mother. So हर जीन के ये दो आपको लोकाई मिलते हैं, एक पैटर्नल क्रोमोसोम पर, एक मैटरनल क्रोमोसोम पर. अगर म्यूटेशन दोनों स्पॉट्स पर है, यानी फ्रॉम द फादर जो जीन एक्वायर हुई है वहाँ भी म्यूटेशन है, और फ्रॉम द मदर जो जीन एक्वायर हुई है वहाँ भी म्यूटेशन है, ऐसी म्यूटेशन को हम नाम देते हैं होमोजाइगस. बट इट इज प्रेजेंट ऑन वन स्ट्रैंड एंड नॉट ऑन द अदर क्रोमोसोम, देन दिस इज कॉल्ड हेटरोजाइगस. सो नाउ रीड दिस स्टेटमेंट अगेन. In the US, approximately 8% of blacks are heterozygous and about 1 in 600 have sickle cell anemia. So that is the kind of frequency and the burden of the disease in the US. Now let's talk about what is the pathogenesis, what is the exact mutation. So sickle cell anemia is basically caused by a single amino acid substitution in the beta globin. So सिर्फ एक amino acid change होता है और पूरा structure of the hemoglobin change हो जाता है. And this actually results in tendency for deoxygenated hemoglobin S to self-associate into polymers. So basically what's happening, there is one single mutation leading to change in only one amino acid, leading to formation of hemoglobin S, and this hemoglobin S is not as efficient as the hemoglobin A to carry oxygen. तो हमारी oxygen carrying capacity सारी disturb हो जाती है. अगर हम नॉर्मल हीमोग्लोबिन की बात करें, सो नॉर्मल हीमोग्लोबिन आर टेट्रामर्स व्हिच आर कंपोज्ड ऑफ 2 pairs of similar chains. On average, the normal adult red blood cell contain 96% of hemoglobin A. अब जब hemoglobin A की हम बात करते हैं, adult hemoglobin, so it contains 2 alpha and 2 beta chains. So if you talk about hemoglobin, I told you it is made up of heme portion and globin portion. Heme portion is basically the iron and globin portion is the protein chain. So there are 4 chains. If there are 2 alpha chains and 2 beta chains, this is what we call hemoglobin A, which is the most common hemoglobin in our red blood cells. But a very small portion of hemoglobin A2 is also present, where we have 2 alpha chains but not 2 beta chains but 2 delta chains. And about 1% there is fetal hemoglobin as well in our RBCs, and the composition is alpha 2 gamma 2 instead of alpha 2 beta 2. So that's something normal, okay? The most abundant hemoglobin A. In patient with sickle cell anemia, what happens कि hemoglobin A is completely, सुने इस बात को, it's completely replaced by hemoglobin S. So we do not have the normal thing, but now we have hemoglobin S. और whereas in heterozygous, ये तो हम बात कर रहे थे कि जिनमें sickle cell anemia है, लेकिन जो heterozygous होंगे उसमें half of them is replaced, okay? So the patients are usually homozygous. Hemoglobin S differ from hemoglobin A in having a valine residue instead of glutamate residue. So this is the shift. There is a valine instead of glutamic acid. So valine instead of glutamate. So this glutamate would have been present in normal hemoglobin A, but because of the mutation, this is no more present, but we have valine. Okay, so just because of this change, the whole structure and the conformation of the hemoglobin changes, and the red blood cells basically sickle कहते हैं इस तरह के structure को, ऐसा question mark type का structure है. Basically ये structure है, laborers मजदूर ये use करते थे, अभी भी करते हैं. उनके पास एक इस तरह का structure होता है जो यहाँ से काफ़ी pointed होता है. What they basically do is कि इस point से वो बड़ी सी कोई भी चावल की बोरी है उसको यहाँ पे ऐसे घोंपते हैं, तो एक अच्छी ग्रिप बन जाती है. एक हाथ में ये पकड़ा, दूसरे हाथ से बोरी उठाई, चलें जी आगे बढ़े. सो दैट इंस्ट्रूमेंट, ये छोटा सा इक्विपमेंट इज सिकल. तो इस शेप के, कॉमा शेप के हमारे रेड ब्लड सेल हो जाते हैं. नॉर्मल शेप ऑफ द रेड ब्लड सेल क्या होती है? इट्स बाय concave from this side and concave from this side. But if they become sickle shaped, this is what is the effect of one change amino acid. And this sickling of red blood cell initially is reversible on reoxygenation, अगर ऑक्सीजन की concentration ठीक ठाक है. However, membrane distortion produced by each sickling episode leads to influx of calcium, and then the cells become irreversibly sickled. 3 factors are particularly important in determining whether clinically significant polymerization of hemoglobin S occur or not. Polymerization का मतलब है ये sickle hemoglobin जो है red blood cell, ये आपस में मिलजुल के polymerize hemoglobin, which is ineffective in carrying oxygen. तो 3 फैक्टर्स हैं जो इसको प्रिवेंट कर सकते हैं, एंड दे विल एक्चुअली डिटरमाइन कि सिकलिंग किस सिवियरिटी की होगी. The intracellular levels of hemoglobins other than hemoglobin S. अगर थोड़ा बहुत दूसरा hemoglobin मौजूद है, then it's a good sign. In heterozygotes, approximately 40% of the hemoglobin is hemoglobin S, and the remaining is about hemoglobin A. So that's a good sign. Because hemoglobin A greatly retards HbS polymerization, the red cell HbS heterozygotes जो हैं उनमें little tendency है for sickling. So point ये है कि अगर मेरे पास एक red blood cell ऐसा है जिसमें hemoglobin S मौजूद है, now that's a bad thing, लेकिन साथ hemoglobin A भी मौजूद है, तो ये hemoglobin A अपना काम भी करता रहेगा और इसको inhibit भी करेगा polymerization से. So that is a good thing if you have some other type of normal hemoglobin. और ऐसा उस वक्त होगा when the disease is heterozygous, यानी एक क्रोमोसोम पर वेलाइन ही मौजूद है लेकिन दूसरे पर वेलाइन की जगह ग्लूटामिक एसिड मौजूद है, बट दिस इज वन स्ट्रैंड इन्वॉल्व्ड, देयरफॉर इट इज हेटेरोजाइगस कंडीशन. लेकिन अगर दोनों ही जगह पर अमाइनो एसिड चेंज हो जाता, देन दैट वुड हैव लेड टू होमोजाइगस सिचुएशन व्हिच वुड हैव बीन मोर सीरियस, क्योंकि उसमें बिल्कुल हीमोग्लोबिन ए नहीं होता, सारे का सारा हीमोग्लोबिन एस होता. Similarly, because fetal hemoglobin, which is hemoglobin F, interacts weakly with HbS, newborn with sickle cell anemia do not manifest the disease until HbF level falls down. अब इसको सोचें, there is a child born जिसके पास hemoglobin S भी मौजूद है उसके रेड ब्लड सेल्स में, लेकिन हीमोग्लोबिन F भी मौजूद है. तो जब तक F मौजूद है S का इफेक्ट नजर नहीं आता, एंड दैट्स व्हाई द डिजीज इज नॉट मैनिफेस्टेड अर्ली. इट टेक्स सम टाइम. जब हीमोग्लोबिन F डाउन होता है 5 से 6 महीने पर, देन द इफेक्ट्स ऑफ हीमोग्लोबिन S स्टार्ट्स अपीयरिंग. Now there is another variant HBC which is a mutant beta globin has a lysine residue instead of glutamic acid. हम जो HBS की बात करते हैं, HBS contains a valine, लेकिन HBC में there is a lysine instead of glutamic acid. At about 20%, 2.3% of American blacks are heterozygous carrier of HBC, and about 1250 newborns are composed of HBC, HBS heterozygote situation, and HBC has a greater tendency to aggregate with HBS than does HBA, and as a result, HBS and HBC compound heterozygotes have a symptomatic sickling disorder, which is HBSC disease. Now that's like a deadly combination. So if somebody, and this is why some patients have more severe disease, some patients have less severe disease, the reason being कि अगर red blood cells में सिर्फ अब combination अगर ये था कि there was sickle cell hemoglobin and there was HbA, so HbA will take care of this, so that's a good hemoglobin. If the combination was hemoglobin S and hemoglobin F, so F can also take care of this, that's a good hemoglobin. But if the combination is that the person is born with hemoglobin S and hemoglobin C, now that's a deadly combination. They will combine together and cause more sickling. So this is something which you must understand. और यही मैं बात कर रहा था कि what are the parameters which actually control the sickling behavior of red blood cells. The second parameter is intracellular concentration of HbS. The polymerization of deoxygenated HbS is strongly concentration dependent. Thus, the red cell dehydration, which increases Hb concentration, will facilitate sickling. And that is very easily understandable concept. If you have red blood cell and they have X concentration of hemoglobin S, but if there is dehydration, then this will obviously increase the concentration of, क्योंकि पानी अब कम हो गया ना, so that's that sort of thing, okay. तो पानी कम हो गया तो solute बढ़ जाएगा, which is the hemoglobin S in this case, and that will behave more dangerously. And the third factor is the time required for red cell to pass through the microvasculature. That's very important. It will determine sickling behavior. The normal transit time of red blood cell through capillary bed are too short for significant polymerization of deoxygenated HbS to occur. It's too short because they pass very rapidly. Hence, the tissues that are most susceptible to obstruction by sickling are those in which the blood flow is normally sluggish. यानी जहाँ से बहुत slowly गुजर रहा है. You give it more time and it will sickle more. However, sickling may occur in other microvascular beds in the face of factors that retard the passage of red blood cells. Recall that inflammation slows the blood flow and therefore increases the chances of sickling. So, दो important factors अभी तक हमने बात की है. Dehydration will increase sickling. Inflammation will increase sickling. Very important because you know inflammation is very common. किसी भी वजह से infection हुआ, inflammation हो रही है. किसी भी वजह से autoimmune disorder है, inflammation हो रही है. That will increase the chances of sickling. Now, sickling of red blood cells has two major pathologic consequences. Sickling से होगा क्या? Okay, what will happen? So, chronic, moderately severe hemolytic anemia produced by red blood cell membrane damage and vascular obstruction. ये दो चीज़ें आपको याद रखनी है कि अगर एक ब्लड वेसल में से ऐसे रेड ब्लड सेल गुजर रहे हैं जिसमें हीमोग्लोबिन ए के बजाय हीमोग्लोबिन एस है, और अगर सिकलिंग हो जाती है, रेड ब्लड सेल की शेप ऐसे हो जाती है, they can clog the blood vessel. So that is one thing which can happen. There is vascular obstruction, clogging of the blood vessel. And the other thing is they will rupture. So there will be hemolytic anemia. So remember these two consequences. These are the two hallmarks of sickling. Okay, the mean lifespan of red blood cell in sickle cell anemia is only about 20 days as compared to 120 days in the normal red blood cell cycle. Vaso-occlusion, by contrast, does not correlate with the number of irreversible, so that's not an important line to pay attention to. Now, the clinical features of these patients, and then I will come back to this morphology box towards the end of the video. Now, the clinical features: from the onset, the disease runs an unremitting course punctuated by sudden crisis. What a beautiful statement. So the patient is always at trouble, but then there are sudden crises. Suddenly the patient have crisis. Homozygous sickle cell disease usually is asymptomatic until 6 months. So ये मैंने आपको बताया, इसलिए 6 month of life तक ये इसमें कोई symptoms नहीं होते, because the red blood cells of the babies, they have hemoglobin S, but they also have hemoglobin F, and the hemoglobin F is good to take care of hemoglobin S. But 5-6 महीने पर when the levels of HbF goes down, then the sickling starts to happen. The anemia is moderate to severe. Most patients have hemocrits of 18 to 30%. As compared to this normal range. The chronic hemolysis is associated obviously with hyperbilirubinemia, because there is more and more destruction of the red blood cell, more and more hemoglobin coming out, and more bilirubin being formed. So this hyperbilirubinemia and jaundice is understandable. And compensatory reticulocytosis, obviously when you are rupturing your red blood cells, your body thinks कि जी anemia हो गया obviously, तो आपका bone marrow reacts more and more, and the bone marrow produce more and more reticulocytes. So you have compensatory reticulocytosis. Much more serious are vaso-occlusive crisis. So एक issue anemia का है, hemolytic anemia. दो pathologies आपको याद रखनी है, मैंने आपको already बता दिया है. One is the hemolytic anemia, and the other one is the occlusion of the red blood of the vascular bed. अगर blood vessels occlude कर जाएं, clog कर जाएं, that's a big problem, and that can lead to then pain in that area. Now imagine आपका ये leg area है, यहाँ पे blood vessel clog हो गई, so there will be no blood supply there. There will be intense pain, and it can sometimes also lead to damage, even morbidity, mortality, depending upon किस part का blood supply बंद हुआ है. Okay, some of the common occlusive crises are as follows. Number 1, hand-foot syndrome, resulting from infarction of bones in the hand and feet. That is usually the most common presenting complaint of the patients, particularly in young children. They come with pain in hand and foot bones. So that's one presentation because of occlusion of the blood vessel. So if this is, say, for example, your hand, and that's a particular blood supply going to the metacarpus, for example, and this is clogged, so there will be issues, infarctions, necrosis in the bones. Okay. The second one is acute chest syndrome, and in this syndrome, sluggish blood flow in inflamed lung leads to sickling within hypoxemic pulmonary bed. So see what's happening, okay, the patient has a pneumonia, और मैंने आपको बताया कि if there is a patient and the person has inflammation, the blood supply this will be disturbed because there is slowing of the blood flow, and whenever there is slowing of the blood flow, there are chances that sickling will happen. So post pneumonia, acute chest syndrome. A stroke, which sometimes occur in the setting of acute chest syndrome as well. Stroke and acute chest syndrome are related, and this can lead to damage to the brain. Proliferative retinopathy is a consequence of vaso-occlusion in the eye. So all these are important syndromes by which patients are presenting to the clinic. So बहुत common है, और आपको ये complications पता होनी चाहिए. One more thing which I would like to spend a couple of minutes on is aplastic crisis. It is caused by sudden decrease in the red cell production, as in hereditary spherocytosis. This usually is triggered by infection of erythroblast by a virus, parvovirus B19, and that leads to shutdown of your bone marrow. In addition to these, so remember this, okay? Now, in addition to these crises in patients with sickle cell disease, they are also prone to infection. Both children and adults with sickle cell disease are functionally asplenic, making them susceptible to infection because there are continuous occlusion in the splenic supply, and the spleen is kind of infarcted, so they don't have a spleen, and if there is no spleen, they are more susceptible to infections. Okay, in adults, particularly the encapsulated bacteria such as pneumococci. In adults, the basis for hyposplenism is autoinfarction. ये मैंने आपको बता दिया कि because if this is the spleen, there is again and again, vaso-occlusion, so there is infarction of the spleen. In homozygous sickle disease, irreversibly sickled red cells are seen in routine peripheral blood smear, so you can identify this. The diagnosis is confirmed by electrophoretic demonstration of hemoglobin S, so you identify it by undertaking the migration pattern of different hemoglobins, so hemoglobin S is identified. It can also be identified prenatally by analyzing the DNA obtained from the fetus by chorionic villus sampling. The clinical course of the disease is highly variable. And it depends upon a lot of different things. So if the patient has inflammation, for example, the clinical course will be very, very complicated. If the patient has hemoglobin C within the red blood cell, so I just told you, okay, if the red blood cell contain hemoglobin S, which is not good, and also hemoglobin C, which is not good, so this is a deadly combination. इस patient का clinical outcome बहुत ही worse होगा as compared to the patient who does not have hemoglobin C. Okay, and how do you usually treat it is the mainstay of treatment is hydroxyurea, which is a gentle inhibitor of DNA synthesis. Hydroxyurea reduces pain crisis, and we'll talk about the management more in pharma and medicine lectures. Okay, so एक दो और मुझे चीजें इसमें डिस्कस करनी. So that's a good diagram showing you that there is hemoglobin A, which is normal, and if there is a point mutation, so if you see here, only a point mutation can lead to production of hemoglobin S, and once you've got hemoglobin S in there, then there is deoxygenation and all those issues, you know, of hemolysis, and microvascular occlusion may occur. So this is one hallmark of the disease, and this is the other, and we have discussed this in detail. Let's spend the last few seconds on the morphology box, that how does it look like morphologically. The anatomic alterations in the sickle cell anemia stem from, number one, severe chronic hemolytic anemia, which means there will be jaundice, hyperbilirubinemia because of hemolysis, increased breakdown of heme to bilirubin, microvascular obstruction, you know, blood vessels clog ho jayenge. So we talked about it, and this particularly happens, say for example in spleen, for example, right? And splenic infarcts will be there, so that's an easy bit to understand. In children, there is moderate splenomegaly due to red pulp congestion caused by entrapment of the, so initially when the body identifies that they have wrong shaped red blood cells, the spleen try to, you know, handle these abnormally shaped red blood cells, and in order to do this attempt of handling them, size of the spleen goes up. So in children there may be splenomegaly, but later on there is continuous clogging of the blood vessels which are going towards the spleen, and there is infarction of the spleen. And practically then the adult does not have a spleen. Spleen है उसके अंदर लेकिन किसी काम की नहीं है. So therefore they are more prone to infections. Vascular congestion, thrombosis and infarction can affect any organ. So जैसे अभी हम ये बात कर रहे थे कि hand foot syndrome, chest में pulmonary bed, they can actually go anywhere, and these red blood cells जिस भी organ की तरफ जा रहे हैं वहाँ अगर ये clog हो गया तो there is ischemia and infarction. Okay, and obviously needless to say that there is gallstone के chances बढ़ जाएंगे, and this is happening because there is hemolysis, so there is more you know, rupture of the red blood cells, more hemoglobin being released and metabolized into bilirubin and then ultimately to the stones. So all are very important concept, and I will then start another hemolytic disorder, thalassemia, in the next video. Till then, take care of yourself.